Gamma knife is an eloquent radiation system that has been designed to treat tumors of the brain. It is a dual procedure that a radiation oncologist does along with a neurosurgeon, and we act as part of a team to design a treatment plan for patients with brain tumors. They can be tumors that started in the brain or tumors that have spread from other parts of the brain. They may be tumors that are malignant, meaning cancerous, or they may be tumors that are benign. As part of the radiation appointment for a gamma knife visit, the physician will describe to you the process of gamma knife. This typically involves a treatment on a specialized machine called a gamma knife, in which a patient lays still and that gamma knife machine delivers invisible radiation to the tumor with very precise targeting. It is not invasive, meaning there's no cutting in the head, even though the name says gamma knife. It is an outpatient procedure where patients can come in and get their treatment and then go home. We have an updated gamma knife that has quite a flexibility and options for treatment. It can deliver treatment in as few as just one treatment, and it can also space out treatments into 5 treatments. And as part of the gamma knife team, we make the decision about which approach would be most appropriate for each patient. Sometimes patients have to be placed in a head frame, we call it, and this is a frame, like a halo you may see, that bolts onto the patient's head and keeps them perfectly still. This is done by numbing up the skin of the patient and having a neurosurgeon place a frame so that when a patient lays on the gamma knife table, their frame is hooked into the gamma knife so that there's absolutely no motion. The gamma knife is incredibly accurate within less than a millimeter of inaccuracy. So being perfectly still is very important in certain situations so that head frame can be utilized. We also have the option on the updated gamma knife machine to make a mask. When I say mask, this is a mesh mask that can spread over the patient's face and be another way to keep the patient still without putting a head frame on. The mask is utilized most frequently when we break the treatments up into different sessions and not just one single session. Whether or not to use the frame or the mask is a decision that's made between the patient and the physicians, including the neurosurgeon and the radiation oncologist, depending upon the situation. For the gamma knife procedure, it will be discussed with you whether or not you may need family assistance for the day of the procedure. Sometimes light sedation is utilized, such as a pill that can help relax patients to lay more still for the treatment. And so in those cases, oftentimes family members will need to come. In other instances where we're utilizing the gamma knife without the head frame and patients are in a mask, it's possible that they may be able to drive themselves to and from treatment. That will be discussed at the time of the consultation with the physician. At the completion of the gamma knife treatment, there will be a family meeting where we will discuss follow-up plans and procedures. Very often, patients will need a follow-up MRI in a number of weeks or months after the gamma knife procedure to make sure of good tolerance and good success to the treatment.